Hope everybody's doing good. Finally getting to this video. Put my toddler to bed. It's 10:30. It's been a long day, long quarantine. But so these videos, the way they impacted me were, well, both of them are pretty upsetting. I know for the first one, I kind of related. I had a similar situation when I was pregnant. I had so much pain in my leg for months, and I took these concerns to the doctor month after month, and it felt like he wasn't listening. It felt like nobody was really taking it serious, just a sign of pregnancy. But it turned out I had a really big blood clot in my leg, and we didn't catch it till, my foot was purple and I couldn't walk anymore. But so it felt very helpless, and as a patient, I can understand what it feels like when nobody's listening, and because of that, I don't ever want to be the nurse that makes her patients feel that way. And so I learned from that experience, and then seeing videos like this, that it's so important to listen and take things seriously, especially patient complaints, even if it doesn't seem like something's wrong from your side, just to understand that you are the advocate. That's your job, and that's someone's life in your hands pretty much. And so it's just really important to listen and take things seriously, and not be afraid to question things that look wrong. So that was for that video. But so as a nurse, just advocating for your patient, making sure that you're looking out for them, and just doing your job right. So how can you apply it to an ortho patient? I guess just recognizing important signs and symptoms of really dangerous conditions like sepsis, and taking the vital steps to prevent that from going any further. I got to see a patient with sepsis at the ER, and it was really cool to see that nurse in the way she cared for that patient. Before she was even diagnosed with sepsis, the nurse had already started preparing to treat her for sepsis, just like one step ahead. So that was something really cool to see, and just seeing her advocate for her patient and just go ahead and start treatment for something before it gets too serious. So what is an osteosarcoma? I wrote it down. An osteosarcoma is a type of bone cancer that begins in the cells that form bone, and usually found in the long bones. It typically occurs in teenagers and young adults, and treatment involves chemo, surgery, sometimes radiation. And that video was super upsetting. I cannot imagine being a parent and being in that position and feeling like you have to fight for your child's life when your child is super sick, and just having doctors not really listening to you, not taking anything seriously, especially when they know something's wrong and they can't find it. So I just can't imagine, and I feel like that death could have been prevented had people listened to the parents and been proactive about the child's decline. So yeah, that's pretty much it.